Hi everyone, welcome back to my YouTube channel. Today we are going to talk about pharynx muscles. So let's start our topic with introduction. Pharynx is a muscular tube that extends from the base of skull to the esophagus, that is at the C6 level. Its wall is composed of two layers of muscles that includes outer circular layer and inner longitudinal layer. Outer circular layer has constrictor muscles that narrow the pharynx, while inner longitudinal layer have muscles that elevate and shorten the pharynx. These muscles work together to perform swallowing, speech, and respiration control. Classification of muscles include outer circular muscles and inner longitudinal muscles. Outer circular muscles are also called as constrictor muscles because they constrict the pharynx, and they include superior constrictor muscle, middle constrictor muscle, and inferior constrictor muscle. While inner longitudinal muscles include stylopharyngeus muscle, palatopharyngeus muscle, and salpingopharyngeus muscle. Outer constrictor muscle includes superior constrictor muscle, middle constrictor muscle, and inferior constrictor muscle. Now let's talk about these constrictor muscles one by one. So first constrictor muscle we have is superior constrictor muscle. It originates from medial pterygoid plate, pterygomandibular raphe, posterior end of mylohyoid line of mandible, and also from the side of tongue. It is inserted into the pharyngeal raphe and pharyngeal tubercle on the base of the skull. Talking about its function, it narrows the nasopharyngeal and oropharyngeal parts during swallowing, and its nerve supply is by pharyngeal plexus of vagus nerve. Next constrictor muscle we have is middle constrictor muscle. It originates from the greater and lesser horns of hyoid bone and stylohyoid ligament. It is inserted into pharyngeal raphe, and its function is to narrow oropharynx, and it pushes bolus downward. Its nerve supply is by pharyngeal plexus of vagus nerve. Third constrictor muscle we have is inferior constrictor muscle. It originates from the oblique line of thyroid cartilage at the side of cricoid cartilage. It is inserted into pharyngeal raphe, and its special feature includes that it has lower fiber that form the cricopharyngeal muscle that is also called as upper esophageal sphincters. Its functions include it narrows laryngopharynx, it prevents air entry into the esophagus. Its nerve supply is by pharyngeal plexus of vagus nerve and also by external and recurrent laryngeal nerve. Now let's talk about inner longitudinal muscles of pharynx. Inner longitudinal muscles of pharynx include stylopharyngeus muscle, palatopharyngeus muscles, and salpingopharyngeus muscle. First we have is stylopharyngeus muscle. It originates from styloid process of temporal bone. It is inserted into the posterior border of thyroid cartilage and pharyngeal wall. Its function is that it elevates pharynx during swallowing and speech, and its nerve supply is by glossopharyngeal nerve. Next longitudinal muscle we have is palatopharyngeal muscle. It originates from hard palate and palatine aponeurosis. It is inserted into the thyroid cartilage and pharyngeal wall. Its function is that it elevates pharynx and larynx, and it also closes oropharyngeal isthmus. Its nerve supply is by pharyngeal plexus of vagus nerve. Next longitudinal muscle we have is salpingopharyngeus muscle. It originates from cartilaginous part of auditory tube, and it is inserted in the palatopharyngeus muscle as it blends with it, and its function is to elevate pharynx and opens auditory tube during swallowing. Its nerve supply is by pharyngeal plexus of vagus nerve. Now let's talk about muscle arrangement of pharynx. Constrictor muscle form a muscular tube with fibers overlapping like shingles. Like inferior constrictor muscle overlaps middle constrictor muscle, which overlaps superior constrictor muscle, while longitudinal muscles run inside the tube, elevating and widening the pharynx during swallowing. Now let's talk about pharyngeal plexus. These are formed by fibers from vagus nerve, by fibers from glossopharyngeal nerve, and by fibers from sympathetic fibers from superior cervical ganglion. Now let's talk about functions of pharyngeal muscles. First function is swallowing or deglutition. As longitudinal muscle elevate the pharynx, while constrictor muscles sequentially contract to push the bolus downward, thus help in process of swallowing. Next function of pharyngeal muscles is speech. as they assist in resonance and articulation of words. Third function of pharyngeal muscle is airway protection, as the constrictor and cricopharyngeus muscle prevent aspiration. Fourth function of pharyngeal muscle is auditory tube opening, as salpingopharyngeus muscle help equalize air pressure. Now let's talk about clinical significance of these pharynx muscles. First is pharyngeal pouch or Zenkus diverticulum. It occurs between thyropharyngeus and cricopharyngeus fibers that cause dysphagia. And second clinical significance is nerve injury, that is damage to vagus nerve that affects swallowing due to loss of motor supply, because most of these muscles are supplied by vagus nerve. So effect on the vagus nerve can cause effect on the swallowing of during on the pharynx. Next clinical significance we have is cricopharyngeal dysfunction, as it can lead to aspiration and esophageal disorders. Next clinical significance is swallowing disorder or dysphagia. That is when muscles or nerve lesion impair coordination of pharyngeal muscles. It can cause swallowing disorders or dysphagia. Now let's talk about conclusion of this lecture video. Pharyngeal muscles form a complex and coordinated muscular apparatus that are essential for swallowing, speech, and airway protection. Knowledge of their anatomy and innervation is vital in ENT, neurology, gastroenterology, and surgery. And this was all about pharynx muscle. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.